Affecting approximately 90% of women, cellulite presents as a dimpled appearance on the skin surface. Beneath the surface of the skin, fat cells separated by an architectural network of collagen-rich connective tissue called fibrous septae tether the dermis to the deep fascia. There are three main structural factors that are associated with the appearance of cellulite. First, women with cellulite tend to have thicker and more rigid fibrous septae, which may cause tension in the dermis. Fat lobules that are segmented by fibrous septae begin to push against the skin, and the dermis becomes thinner. Together, these three factors contribute to the dimpled appearance of cellulite. Quo is the first and only FDA-approved injectable specifically designed to treat moderate to severe cellulite in the buttocks of adult women. Quo is contraindicated in patients with a history of hypersensitivity to collagenase or to any of the excipients or the presence of infection at the injection sites. After reconstitution, Quo is injected subcutaneously under the surface of the skin at the dimples. Quo is a mixture of two purified and highly specific collagenase enzymes, OX1 and OX2, which work synergistically to lyse type 1 and type 3 collagen in fibrous septae and the extracellular matrix. The exact mechanism of Quo for the treatment of moderate to severe cellulite is unknown. After Quo is injected, enzymatic subcision and remodeling, or ESR, begins. ESR is believed to initiate as the enzymes work on the fibrous septa to release the cellulite dimple. With the fibrous septa detached, fat lobules begin to reorganize and spread more evenly. At therapeutic concentrations, the enzymatic activity of Quo does not damage arteries, nerves, and large veins themselves, since these structures contain type 4 collagen. Small venules that are supported by the extracellular matrix may leak, causing bruising as their support is affected by Quo. In clinical studies, injection site bruising occurred frequently after Quo administration. This enzymatic activity stimulates neocollagenesis. From within, this collagen support network rebuilds itself in the extracellular matrix with thinner, smaller septae. These subdermal changes reduce tension and help thicken the dermis, creating a smoother appearance.
Thank you for joining us for today's Lunch and Learn about our new exciting product called Quo. I'm here with Dr. Steven Swengel, a board-certified dermatologist and director of RefinedMD. Nice to have you here today.
Thank you. It's good being here, and I'm excited to offer this product at RefinedMD.
You know, the only thing that seems to be missing for this Lunch and Learn is lunch for me. but at least all of you are probably having lunch, and we're going to try to make this an educational event where we deliver some good information for you about this product so that you can assess and kind of feel like you have some knowledge and an ability to determine if this would be a good treatment for you. So tell us about what this product does.
I was going to also mention the other thing that's missing today, which I'm really thrilled to announce, is that we're not wearing masks. And everyone at RefinedMD has had the luxury of being able to be immunized for COVID, and the CDC is now recommending that people who are known to have been vaccinated can actually be mask-free in the presence of a small group of other people who've been vaccinated. So yay and yahoo, we are now actually able to talk without a mask.
Of course, in our clinic where we see people day to day, we have to wear masks because we're never sure of anyone's vaccination status.
Right.
So let's get started. Let's talk about Quo. Tell me why you decided to bring this into your clinic and kind of what's a good patient for this.
Well, you know, with our body contouring center, we find that there's always a lot of requests about dimpling, skin laxity, and cellulite. And we've always been kind of looking for a treatment that was predictable, relatively easy to administer, and would give people long-term outstanding results. A lot of the kind of the European style treatments where we're using treatments to just kind of pound the fat, so to speak, yeah, it got a little better, but just didn't really do that much, didn't last that long. Probably the best treatment up until now was a surgical treatment called Selfina, which I did quite a few of, and it worked, but it was a very time-consuming, complicated treatment and a physical treatment where we literally had to use a very sharp blade to undermine cellulite. So there was truly some physical injury to the skin to release these bands. What Quo does is that Quo is actually an injectable product, a collagenase Clostridium histolyticum, just to give you the name of it. It's actually derived from a bacteria that's been purified and stabilized, and this is injected into a cellulite dimple, and what it does is it actually just releases that same fibrous band that Selfina otherwise would cut with a sharp blade. So it kind of takes it from being a 2-hour procedure to more like a half-hour procedure each time you come in for a treatment.
Wow, that's really exciting news.
It really is.
Because dimples, they're just not attractive, and so many women have them, and so many women have for years sought treatments for them.
Right, I mean, they really say that about 90% of women have some degree of cellulite. Some are mild and some are quite severe. But it's kind of interesting, it's only really women who get cellulite because of the orientation of their septal fibers. But for women who really have a noticeable amount of dimpling on their buttocks, this really bothers them. So this will give them an opportunity to address it in a relatively cost-effective way.
So you brought up an important point, cost. And I wanted to ask you, does the severity of the patient's dimpling increase or decrease the cost, or is it always, are you anticipating this will cost the same for all patients?
Well,
it's kind of a range.
It's a range. And what I've always said, just like projects at home, is always time and materials. The more time we have to spend and the more vials of product we have to use, the more expensive it will get. But the overall 3 injection visit cost of Quo will probably be less than some of the more moderate to severe treatments that we did for cellulite with Selfina. So it's going to be a much more cost-effective way to treat.
That's good to know.
Yeah, it really
so
is.
How many dimples can you treat, say in a single session, or is this a multi-session treatment?
Well, I think what we could do here is actually talk about this is kind of the FDA cleared treatment at this point in time. Every product comes out actually being FDA cleared in a very controlled study where they choose the candidates who are going to be subjects. They define what's going to be treated, how often, and so this is kind of coming out of the controlled studies where they did hundreds of women with this and got the results that made Quo FDA cleared. Right now, the system actually suggests to us that the maximum number of dimples treated is 12 dimples per side, which would be a total of 24 dimples. So in the first treatment, we basically identify and circle the ones that are the most noticeable and use that injection visit to treat the most noticeable sites. The second visit, some of the original sites may have actually improved to the point you're saying you don't need to do it. It's fine. I kind of like to equate it with gardening, and you're pulling weeds out of a garden. How if you are a gardener, you pull out the big weeds, and after you get the big ones out, you suddenly realize that there's a whole other group of smaller weeds. So you can kind of fine-tune the treatment until you actually achieve acceptable results. The treatments are done every 3 weeks for a series of 3 treatments. So you come in day 1, you come in very close to week 3, and then the final treatment's at week 6.
Okay. So are you accepting all ages, for instance, into your client? What happened in the studies? Do you know who was the youngest? What's the oldest patient that's been treated?
Well, again, because of FDA sort of rules, they really weren't treating anyone under the age of 18. Weren't treating women who were pregnant. The biggest exclusion, though, was people who really demonstrated more skin laxity than dimpling. And laxity happens to all of us. As we get older, our skin just starts going south. So you really have to factor in, is what I'm seeing, laxity because of age, or is it true dimpling and cellulite? What's kind of interesting is that even if a woman is age 60, she will often say, I've had this since I was a teenager. So that to me is a good indicator that it truly is, there is cellulite there. The other thing that I've learned to do over the years is you can actually make cellulite a lot more noticeable by saying clench your butt. So what seems to be a soft sort of dimple will become a much more dramatic dimple, and that again is a strong indicator that that's cellulite. The area I don't like to treat, and I just point this out to anyone coming in, is if you can take your hand and, for example, place it on your thigh or place it on your fanny and just gently pull up, at most a half inch to a full inch, and all that dimpling kind of disappears. That's laxity. So that's something we don't want to treat because number one, it's not going to really give you results because those aren't the fibers that will respond to this injection. And number two, it could actually make it worse by allowing some fiber septate to actually release even more, and then the skin starts sagging even more dramatically. So we have to eliminate that group of people.
That makes sense.
And with skin laxity, you really have to say, so what are our options? And that's where you try to use some modality where you're delivering heat to the skin to tighten collagen, build it up, or you're also injecting collagen builders such as Sculptra or Radius to actually stimulate collagen formation so that you can actually get some lifting of those descending tissues. Yeah.
That sounds like a good option. Are you anticipating using Quo then as more of a standalone, or are you going to pair it with radio frequency and some of these other injectables for skin tightening?
I think the ideal candidate would be someone where we could just say this is a standalone treatment. I think women who are in their 20s, 30s, maybe even early 40s, it could be a relatively pure treatment and giving you results because you don't have that laxity. But once laxity kind of appears, and it will in all of us at some point in time, then you have to start adding other treatments, possibly or probably after you treat the cellulite. And that's where I think we tend to use the injectables to stimulate collagen as well as the heat devices to actually stimulate collagen as well. And they're kind of synergistic. Mm-hmm. I always say it's a 1 + 1 = 3. That doing one will give you some results, but doing both will give you much, much better results.
Mm-hmm. Now I'm sure you've told us that the treatment involves a needle. Some people are going to wonder, like, how much does this hurt beyond the injection? Like, is there a burning sensation to this medication? Do I bruise? What would you?
Actually, it's very simple. I don't think people need to apply numbing medications because each dimple literally only gets one injection point. So it's a very fine needle, which probably you're not going to even feel. But through that one injection point, we actually deposit 3 aliquots of the product without actually coming out of your skin again. So it's go straight into the dimple, go 45 degrees north, go 45 degrees south. That's the treatment for a dimple. Mm-hmm. And actually the dissolution of those fibers septate occurs very quickly. I mean, literally, you'll see it on the table, and I don't think it's really painful in any way. The big thing that 80% of people, or even more than 80%, have to appreciate is that you're going to bruise. And the bruising is very noticeable. It's not painful. It will go away. It takes about 2 weeks to fade, but you just have to anticipate bruising. Mm-hmm. I think people can do some things to minimize bruising and to kind of help us and help yourself by avoiding things that actually can contribute to bruising. Aspirin, non-steroidal anti-inflammatories like naproxen, Motrin, fish oil. Excessive alcohol before and after a treatment can actually contribute to bruising.
That doesn't sound fun. Ladies, you're going to have to give up drinking before this treatment.
Well, a glass of wine is one thing, but amazingly, excessive alcohol actually affects platelet function. So that's why you want to avoid that. Another thing is we also have a anti-bruise, anti-swelling product that's called Arnica Forte that I think for people who they wanted to kind of do their part, not only do all the avoidance issues, but take Arnica Forte for a day or two before and a couple days afterwards. One bottle then would probably be an adequate amount for 2 or 3 treatments, so you don't have to take it to the full course. And I have found that Arnica Forte actually works better for bruising than pure Arnica.
Thank you. Now, I first heard of Quo, I believe I was with you at a cosmetic dermatology meeting in Aspen, Colorado, and we met the marketing director from Endo on the bus, I think, going to one of the meeting. And
right.
she was so excited about her product and just talking about this as kind of like a breakthrough. And now it's finally here, so that's good. Do you think this is going to be as much of a breakthrough as she was excited about?
I think it will be. In fact, I think it will probably become the leading treatment for cellulite in the appropriate patients.
Mm-hmm.
I'm really looking forward to going back to meetings one of these days, because I found that meetings were just a great way to actually disseminate information and to talk to people directly, and I've really missed that for the last year.
Me too. So you answered it before, but I just want to like pin you down a little bit. Give me a dollar number. Like, what's the range in cost for a treatment? Because like some people, there's a lot of people that are interested in consulting, but I think they want, their time is valuable too. They don't want to do a consultation and find out that this is just way out of the ballpark. Can you give me kind of a number or a range of numbers for the treatment we call it?
Yeah.
Treatment plan would cost?
Yeah, I will. I think, as I said before, you have to always think of it as a time and material sort of event.
Mm-hmm.
And I think that people with, kind of like 12 dimples versus 24, we're really looking at probably $2,000 for all 3 treatments, and up to $3,000 for all 3 treatments if you're treating 12 dimples per size. So again, that just means more time to inject and more product being used. So it's going to probably be in the $2,000 to $3,000 range, which is less than that's less than Selfino was.
Yeah.
And a much easier event too. So I think it will be, a very palatable treatment for women who want to address their cellulite.
Now, if people get treatments now, they can kind of have the body ready for summer, right?
Yeah, you start pretty soon.
enough.
Yeah. We're going to be having the first distribution of products starting middle of next week. I'm not sure the amount that's coming, but we're going to be posting some pictures of the treatment so you can see what we're doing, see how easy it is, and realize that not only is there the injection point, but then there's also, when you come to visit, we'll put you in a little black thong, and we'll provide the thong so that we have consistent photographs. Our photographer will take a picture of you before the treatment, also with the circled cellulite dimple, so we know what we've treated that particular visit. And so each time you come in, there's a pre and a post circling event. So we've got to factor in the photography time too.
Mm-hmm. There's a question here from somebody in the audience. They want to just recap, how does it work? What's the magic in this solution?
Well, as I said, it's Clostridium histolyticum, and
I know what that is.
Collagenase Clostridium histolyticum. And this is an enzyme. Yeah, it's a mouthful. It's an enzyme produced by Clostridium histolyticum, and actually, it's kind of interesting when you think about it. When a Clostridium infection takes over, you actually get necrosis of tissue and gangrene because it's just being released everywhere. So that's what causes tissues to necrose. Well, this has been purified and taken down to the right level, where that product, when it's injected, only addresses type 1 and 3 collagen fibroseptic. So it doesn't affect the collagen that's in arteries. It doesn't attack other forms of
Good
collagen. Good collagen. Only the dimpling collagen. So what happens is that in a period of 5 to 10 minutes, it basically digests and releases that septa. It comes up, allows that skin to come in to the surface, kind of to level off, and then actually surrounding fat just flows in and fills that gap. So it minimizes the ability for that fibroseptite to reform. So it's an enzymatic process.
Okay. Another question from the audience. Any restrictions on activity once, like the day after injection or the week after injection?
The day of, I think you definitely want to take it easy. I think it might actually be appropriate to have people get a pair of Spanx so they can kind of give a little support to their skin, and also kind of contribute a little bit to the contour of their skin, so that what has flowed in and melded and molded and improved the contour of your buttocks would actually kind of be maintained by Spanx. But it's not necessary. Their study was just come in, photograph, inject, and resume activities the next day.
Thank you. In my conversation with a lot of body contouring patients, I see so many people expressing their concern about cellulite, but they're often pointing to cellulite like below the buttocks. So do you think it will be long before doctors such as you do off-label treatments and do something other than just the buttocks? Because we're talking about thighs. Ladies are always saying, well, I show my thighs, but I only show my buttocks to 1 or 2 people. but they're all showing their thighs when they're wearing a short skirt. They want their thighs treated. So like, what can we do?
Well, I think most of these products, I was trying to think of, Kybella would be a good one. There was a very precise FDA clearance just for submental fat. Well, now I'm going out onto I do call it a horse collar of fat. Even go up to, if people have a pre-jowl fat pocket, we'll even treat that. So I go off label. We can use it even off the face, but Kybella is outrageously expensive, and getting off the face just is breathtakingly costly. I think we will, but I think we all want to get some experience and get comfortable with areas that were FDA cleared. I think the one thing you always have to kind of factor in is this cellulite or is this laxity? And everyone comes in and goes, it's my thighs, it's cellulite. It's like, no, it's laxity. So that will be the big discussion with people and the big demonstration every time someone comes in for lateral thighs.
Another question is, body treatments, are these for people that are like at their ideal body weight? Can this be done to somebody, even if I acknowledge I have 10 or 15 pounds still to lose, would it be better to lose that weight first and then postpone the treatment and do it later? And then the other question is, on the flip side, if I do the treatment and then I gain weight, will my dimples come back?
Well, that's kind of a complicated question. I don't think everyone or anyone has a perfect answer to that. I think that ideally you should be at or near your ideal body weight, or at least be consistently at a BMI that isn't changing. I think the fluctuation of body fat makes all body contouring a little bit unpredictable. But I would have to say that adding body weight and fat, if you start gaining weight, isn't going to really impact the fiber septa. I mean, so you're going to gain weight, and there's going to be not additional fat cells, but just enlargement of the existing fat cells. I mean, most people appreciate you don't add fat cells. The fat cells that you're literally born with just get bigger. So I think that it's not going to really affect the cellulite, but I think everyone is always looking for their aesthetic best, and I think ideal body weight is always the best place to be.
Nice. Well, I hope you guys can appreciate that this is a treatment that we're really excited to offer, and to be among the first to offer it at RefinedMD. Dr. Swingle is one of the first in the country to be trained in injecting and using this injectable device. So this is fantastic. We look forward to having you come in for personalized consultations so we can help you with the assessment and then make the appointment. So thank you for attending today, and look forward to seeing you.